Okay, looks like we have some folks joining us, so we'll just wait here as students start to appear. Just give it a few more minutes here, folks, as people try to squeeze in a phone call before or after dinner, depending on time zone. I know I'm before dinner, so you might be able to tell. Might look hungry. Well, you might not be that hungry after I tell this first story I'm going to share here with you all. Well, I am going to get started. We'll hopefully have more folks join us. If not, that's okay. I am recording this just for your awareness. And I will continue to record these live sessions and post them the following day, which is one reason why some people don't show up to these. But I always appreciate when people do, and it's a great opportunity to ask questions and learn a little bit more than what's in your course textbook and in the course. So here I see some more folks joining us, so that's good. So we'll just hang in here just for a brief second as people pop on. It was my pleasure to read the introductions that many of you posted in the course shell. I'm always amazed, especially in this course, the really cool things that our students are doing. I encourage you to go and read those brief bios. A lot of people shared what their career goals are, what they're currently working in, and across the board, we have a lot of students in this course who are already out there working in healthcare, looking to become a healthcare administrator or get a promotion or get involved in research. We have some folks who are more public health oriented in this class. We have ones that are healthcare administration, and we also have health informatics students in this class. So depending on which program you're in, you may or may not have met many of the people who are in this course in other courses. So it's kind of a little melting pot here we've got going on in research methods. And it's one reason I enjoy teaching this course is we have students from different programs. And it is a core course across the three specializations in public health. And often it's one of the last courses that students take within the public health sequence, as I understand it is for many of you as well in the other programs, including healthcare administration and health informatics, and I may be missing one or two programs. In any case, you're all here because you're required to, but also research is a key component of what you all will be doing, whether you know it or not, and whether or not you are a researcher or not, or plan to be one. Since you all shared a little about yourselves in the bio, it'd only be fair if I do as well. I am an epidemiologist and biostatistician by training. So as an undergrad, I was studying biology, and this was back in the early 1990s. And uh, I had a professor who was a bird population biologist in studying birds. And she said if she could go back and study anything, it would be epidemiology, because at that time, this was early 90s, HIV/AIDS was still a deadly disease. There was no real effective treatment, there was no cure. And she was thinking, well, if I could apply what I know about birds to human populations, maybe we could do something about um, this pandemic. And in that same year, Arthur Ashe, the tennis player, was a visiting professor on our campus. And as you may or may not know, Arthur Ashe died of AIDS. He actually got AIDS as part of a blood transfusion. And so that was still happening in the early 90s, if you were around. And so things were really scary with respect to a lot of infectious disease. And it wasn't until we had first with Ebola and then SARS and then COVID that we had, quite that level of interest in an infectious disease, with a few others thrown in there, Zika and chikungunya and all those. But anyway, so I had never heard the term epidemiologist before, and so when and my school didn't have a program in that, and so uh, as I was considering going back to school or go to work, I took a job because I had had some class in statistics and research methods um, on as a case control study of Alzheimer's disease. And so this was back in 1998. And I was working just as a research assistant. I know some of you have mentioned working as a research assistant. And it just so happened that many of my bosses were epidemiologists and they were doing this case control study. And so I decided, well, hey, I'm already being mentored by these folks. I may as well get my degree. So I did my MPH degree finished up in like 2000, 2001. And then it was 10 years later, I decided to get, oh no, 10 years later, I finished my PhD. It took me 5 or 6 years to finish that. So since then, 2011, I've been doing a lot of research, and this is actually marking my 25th year, I think, in public health and research. So before coming to NU, I worked in the Department of Surgery at University of Washington here. I'm in Seattle, Washington. And we did a lot of clinical epidemiology work. So looking at clinical outcomes within our patient population, thinking about public health, not so much in terms of the entire population like the United States, but our population as defined by University of Washington's kind of catchment area, which is actually 5 states, um, and answering important questions was what we were hoping to do. And so I thought I would share a story that I came across relevant to surgery, but also super relevant to public health and science, and then how we come to make progress in health and medicine. So I'm going to tell the story of Ignaz Semmelweis, and I promise there's a happy ending to this story. Doesn't start off great, but I promise there is a happy ending to the story. So Ignaz Semmelweis was a surgeon in Hungary, or what is now Hungary. I don't think it was called Hungary at the time. I mean, there was Hungarian people, but I think nation-wise it was something else, possibly, or the part of the Austro-Hungarian Empire. My history is not great, but that's the part of the world he was in. So I'm sure one of you can correct me on that one. So anyway, Ignaz Semmelweis was curious why it was that women were dying from what they would call childbed fever or puerperal fever as we know it now. This is a cause of maternal mortality that was very high in Semmelweis's time, as high as 10% in some areas. And so it was a huge public health issue, a huge burden on women, and there wasn't much science happening on what the cause of it was. So Ignaz Semmelweis made a few key observations. The first was that he noticed that the rates of death by childbed fever or puerperal fever was higher in one clinic versus another clinic. So you can imagine if you're a health informatics student, or if you're a healthcare administration student, or a public health student, how just having data about what's happening across two different hospitals, comparing, contrasting these things, it could point to some important differences, right, in how things are going across all kinds of things, including to this day both infant mortality and maternal mortality, which thankfully is not as high as it, nearly as high, obviously, as it was in Semmelweis's time. But just noticing those differences. Well, he also recognized that there was another difference between these two hospitals. Again, one had a much higher rate of puerperal fever than the other. He noted one was uh, babies were delivered by midwives in the first hospital, and they were delivered by doctors in the other hospital. So that was his first observation, higher death rate in one versus the other. And, didn't need a statistical test to see the difference. It was one of those just vastly different rates. And so you try to come up with a theory, a working hypothesis about why that might be. And his first inclination was to think about the differences between how babies were delivered in the two hospitals. And in the midwives, I'm sorry, I should note that it was in the midwives hospital that the rate was lower. In fact, almost zero, or was zero in the hospital where babies were delivered by midwives. It was much higher where it was they were delivered by doctors. So he certainly wasn't going to just blame the doctors for incompetence or something else. So he uh, noticed that in the midwives would have women deliver while lying on their sides, whereas doctors had a more traditional setup and lying on their back. Women were lying on their back. So, being a budding medical scientist, he decided to have the surgeons and the doctors have women deliver laying on their sides like they were with the midwives. Well, it didn't make a difference. They still had higher rates of puerperal fever and mortality or sepsis than the midwives. So he had a second theory. This one's a little cuckoo. That was that he noticed that in the hospital, the priest would come. This sounds like a joke at this point. A priest would come in and ring a bell down the hallway. And he thought, well, maybe somehow this was causing anxiety or something in the mothers. So he ordered the priest to stop doing that. As you can imagine, this had no effect on the rates of childbed fever. And it wasn't, and he was stumped. He would continue to monitor these rates and see that they were consistently higher in the one hospital. Well, then there was finally a breakthrough. One of his colleagues at the surgical hospital came down with sepsis. And the symptoms appeared very similar to those that the women were experiencing from childbed fever. So he thought, well, what is it that, and again, this is pre-germ theory of disease, what is it that would lead to this surgeon having this similar presentation? Well, he noticed that the um, physicians, as part of their training, would do autopsies. So he hypothesized that there was something about working on bodies or corpses that was leading these doctors, or in this case, this doctor, to die from something very similar. And so he came um, up with this theory that what he called cadaverous particles, there's a word you can throw around the dinner table, cadaverous particles were responsible for sepsis. And he thought that perhaps the doctors were going from doing these autopsies to work to delivering babies, and they could be carrying those cadaverous particles to the women. Again, pre-germ theory of disease. And um, he he decided his intervention was going to be to use chlorine. Now, he didn't know exactly how chlorine worked because, again, at this time, pre-germ theory of disease, pre-microscope, didn't know about bacteria. But he did use chlorine because that would remove the smell of the cadaverous particles? Well, he required that the um, surgeons wash their hands using this chlorinated water. And sure enough, the rates of puerperal fever dropped precipitously. And you'd think that that would have been good enough evidence for everyone to start washing their hands, and especially between doing autopsy and delivering a baby. Well, the reaction was not that. In fact, Semmelweis was considered um, a bit of a lunatic for proposing this theory. And in some ways, the doctors themselves were insulted with the idea that perhaps they were indirectly causing these women to die by not washing their hands. And so, because of their high position, their high status, also because of the lack of knowledge, Semmelweis was actually admonished and eventually banned from the hospital, and ended up living the remainder of his life in a mental institution. And died at the age of 47 from sepsis himself. Had nothing to do with any of the things I was just talking about, but apparently blood infections were fairly common, just the unsanitary environment in which he was living. So he died in obscurity. But as we now know, hand washing is pretty darn important in surgical practice. And I promised a happy ending here. Um, there's an iPhone that unfortunately the mute has come off. It's real easy to do that. I know. I can, yeah. Oh, there we go. Thanks. Um, so right when I was getting to the punchline. Um, so even though Semmelweis died in anonymity and was shunned by his own medical community, the the most prominent research and medical hospital in Hungary or in Budapest is named for Semmelweis. It's Semmelweis University. So he finally got his acclaim for um, his contributions to medicine, which are sterilization or um, chlorination of surgical devices, hands, etc. But to this day, surgeons are less likely to wash their hands than nurses. It's been shown in studies all over the world that despite all the evidence in favor of it, despite that becoming not only evidence-based practice, but essential practice for safety in surgical care, the rates of consistent hand washing is actually lower among surgeons than it is other other clinicians. So we still have some work to do all these years later. So why do we do research? Well, it's so we can obtain systematic evidence, and sometimes it can take a while for that evidence to be realized into and integrated into evidence-based practice. In this case, well after his lifetime did it become normal or part of practice. Okay, so there's a little story to start you off. I promised that it had a happy ending. And so maybe you'll have a university named after you if you just persist, even if your ideas seem a little silly or kooky. There are more than a few stories like that where someone had a breakthrough that wasn't completely appreciated until after they passed, or it wasn't until other scientists were able to prove their theories correct. So I want to talk a little bit about the differences between research and evaluation, because for those of you who are working in hospital settings or are in more applied settings, you may not be as interested in doing research. However, the motivation, the process of doing research and evaluation are actually very, very similar. So depending on what courses you've taken prior to this one, you may or may not have been exposed to evaluation as a concept. But I do want to distinguish between the two because they're very important. And as you go through the city training, um, which is a very valuable course on research ethics, it applies equally to doing evaluation work. And it's tempting to say, well, I'm not actually doing research, and therefore some of these issues regarding confidentiality of data, um, all the ethical principles that are introduced to you during um, your city training, it's tempting to think you don't need to do that for evaluation, and you do. It is true that if something were to go through an institutional review, they may say, well, this does not constitute human subjects research, this is evaluation. Uh, but my bias would be to say that you should always think of it as doing research and using the most strict ethical standards that you would consider using. So evaluation is often more time limited in its scope and used to determine if a project, a process, or some local intervention or program is effective. Okay, usually you're not trying to generalize beyond that single setting. So let's say you try to implement some sort of process control or process improvement project within your hospital. You're not necessarily thinking about that in terms of publishing a paper or spreading general scientific knowledge. You simply want to do a project and you want to use evidence and data to determine whether that's working. Well, that would be evaluation. But the way in which you collect data, the way in which you recruit patients, the way in which you communicate the results of that data should actually still follow the standards of research. Now, there's a little leeway when it comes to working with medical colleagues and implementing change, let's say within a floor, within a unit, and the ability to share information back and forth. But HIPAA rules still apply. The need for confidentiality still applies, and particularly in terms of and doing any reporting out on the effectiveness of these interventions. Research, which is what we're more focused on in this course, and which is what we are focused on, is based on using samples to create generalizable knowledge to larger populations. So the difference here is that whereas evaluation is more local, more focused on the here and now, these specific individuals, these specific people, research is trying to create generalizable knowledge. And often that means sampling in a way that you're getting a population that you can generalize to a larger population, something that you learn in statistical methods. So how do you get a patient population that is representative of some patient group, let's say Alzheimer's disease or Parkinson's or any name a disease, or you're just studying people who are exposed to something and interested in to see what kinds of outcomes they have. It doesn't always have to start with a specific disease population, but you're interested in making some sort of more generalized statement about those populations. So most of the differences in research and evaluation have to do with the underlying purpose of doing research versus evaluation. So evaluation would be to establish or improve the effectiveness of a program, something that you might do at your own hospital, in your own community. Research, again, creating new scientific knowledge. Evaluation would also often recommend improvements for an existing program or something that was maybe adopted from one location and implemented within your location, and it might recommend improvements. Whereas research would try to generalize results from a sample to a larger population, and often these are novel findings or new questions, not necessarily confirming what was done already in an existing program. It may propose an entirely new intervention, for example. Evaluation, you can think of it as providing useful feedback or operationalizable feedback. Research, we hope to draw conclusions or to contribute to our ability to draw conclusions. It's also a little bit different in how it's reported. Evaluation would often be reported out to the immediate group of stakeholders, so the head of the hospital, um, basically whoever really needs to know within that setting or within that community. Whereas research is more often than not reported by publication. That can include abstracts presented at conferences and other things, but usually to really be part of the scientific knowledge, it will be published somewhere in the scientific literature. Um, Evaluation uses data and facts as part of the process, whereas research, we're using data to test hypotheses formally. So they're very similar, but there are some key differences. The similarities are that both research and evaluation use data, and both can use primary or secondary data. So primary data is data that you collect yourself. For example, using survey instruments, interviews, focus groups, anything where you identify a group and you collect that data. And you can do that in an evaluation setting, you can do that in a research setting. Secondary data is data that's already been collected. And this is more and more common, especially with the expansion of the electronic medical record. Vast amount of secondary data exists, claims data. Um, and you could think of that as maybe primary data if you're kind of the first to be collecting it and using it in a sample. But usually what we mean by secondary data is someone has already collected a survey and conducted a survey, like the YRBS, the Youth Risk Behavior Survey, or the NHANES, or any of those kind of national survey. That would be secondary data because it's already been collected. And that's an important distinction to make. Primary data tends to be more labor intensive. You have to wait for it to accumulate. It's expensive usually, unless you're doing some sort of web-based survey or something like that. So primary data collection has huge advantages because you can design it to be specific to your question, whereas secondary data, the major advantage is it's already collected and you can use it to test different hypotheses. Likewise, in evaluation and research, you're going to use both qualitative and quantitative methods. Your textbook does a very good job of balancing, I think, a focus on quantitative, qualitative, and mixed methods. And I can't help it that quantitative and qualitative sound super similar. And it's easy to mix them up as you say them or you put them in writing. But obviously qualitative has to do with the qualities of something. So things that you can describe using words, but can't necessarily quantify, that are more conceptual or expressed, but not numeric. Quantitative methods are things that you can count, things that you can quantify. And there's obviously a huge blurring of these and certain things. You can think of some research questions on a survey being more or less qualitative in nature, where someone is relating something about their subjective experience. So for example, self-reported health, you could think of it's somewhat qualitative, but we ultimately then assign a number to that, 1, 2, 3, 4, 5, and that has some sort of numeric meaning. So I don't usually get too hung up on the distinction between the two. But there are different methods that you're going to learn in this course that relate specifically to qualitative methods versus quantitative methods. And you'll notice that quantitative methods are much more structured, and some of you may be more comfortable with that. Qualitative methods are much more, I don't want to say loosey-goosey because that's not fair to qualitative methodologists, but it's more of about the researcher putting themselves in the shoes of participants or learning from the participants themselves, their stories, their narratives, and so on, and using that to kind of inform what's going on. And there are huge benefits to both, right? If there's some new phenomenon that we don't know very much about, or we don't have any existing data, it makes sense to use a qualitative approach where you interview people who are working on the front lines, trying to gather information, trying to understand some complex phenomenon, can often start with qualitative approach. And that would be highly justifiable. Quantitative methods can also be done first if there is some sort of data available or you're able to quantify or collect it. And often they're used hand in hand, which you'll learn in the context of mixed methods. Mixed methods is the new kid on the block, so to speak. It started around the 1980s as far as being a named thing. Uh, and before that, there really wasn't as strong a distinction between qualitative and quantitative methods. But the point here is that you do apply it to both evaluation and research. Both evaluation and research use statistical methods for data analysis. So I mentioned in the case of evaluation, you might be using control charts or something like that, process improvement type metrics. They're still all based on statistics, right, and probabilities. And the actual tools that you use might look a little different, but they're based on statistical principles. And they both involve some sort of decision-making rule. So in statistics, we often have this arbitrary cutoff of if something is significant at alpha point or t less than 0.05, we're going to say that it's statistically significant, right? Well, likewise, in evaluation, we would have some sort of criteria that we set in advance for what would it mean for our intervention to be successful or considered effective. And you usually live by that decision. So like, let's say that we're going to implement this new process if we can improve outcomes by 10% or more. Because let's say there's some cost involved with it. It's not like maybe it slows things down a little bit. But if your criteria is that you're improving some outcome by 10% or more, that's when you make a decision based on that criteria that you're going to go ahead and implement that intervention long term. So both evaluation and research have these sort of decision rules. And in the case of research, it would be how credible is this evidence? And is this likely to be real or is it by chance? And similarly, having standards for what the quality of evidence would be. So different study designs would yield different levels of quality. So if something was randomized, it might be considered a higher level of evidence, pure experimental design. If it was observational, you just happen to notice that ultimately what Semmelweis did at first was observational. He looked at the rates of fever or childbed fever in the two hospitals. That's an observation based on data, and then tried to come up with a theory about what was happening. He ultimately went to trying more randomized or experimental approaches, having the one hospital, have women lay on their side and see if that had any change, and doing the same thing in the midwife's hospital, or just not doing anything with them, letting them go as normal. And the only thing they changed was how babies were delivered laterally or on their backs. And so that could be considered a higher level of evidence since it was randomized. So why do research or why do evaluation? And you're often looking to identify unmet needs and gaps in services. You're trying to plan effective program implementation, how to improve your program services, making decisions on cost effectiveness. This is a huge area in healthcare research is not just, is it effective, but is it just as effective to use this procedure versus something else. We're not in a world, and we've never been in a world where you can just do everything for everyone all the time. And it's really hard to realize that there are limitations. And so how can you most cost effectively provide the same level of care or even improve outcomes while saving, um, doing it cost effectively. And so that's a huge area of research, and it's almost like its own area of health services research, which would be more focused on cost effectiveness. But even doctors and more science-oriented folks are increasingly interested in this because as a scientist, they never want to do something that certainly would harm someone. And you can think of someone paying for something that's ineffective as harming someone, right? So if you're doing unnecessary tests on someone, let's say it's something relatively benign, but it still costs more money, you have an interest in reducing that, right? Just as you would something that would affect their health. So it's not like you have to be interested in pure science versus cost to be interested in cost effectiveness. Um, and you could also use it to simply monitor or assure that the program you're implementing is being done with fidelity, meaning is it being done the way it was intended to be implemented? And so evaluation can often be done with that. And a good example of that from my own experience was um, at the University of Miami, there was a new um, therapy that was proving to be very effective, particularly for children with severe emotional disturbances. And we often use the term SED or severe emotional disturbances for youth rather than applying some specific diagnoses, right? So it could be some sort of antisocial behavior. It could be something that manifests more like a psychosis or a depression, but it's more kind of a catch-all for um, adolescents who are experiencing um, behavioral issues. In any case, this University of Miami implemented this new therapy called Brief Strategic Family Therapy, or BSFT, and we're having outstanding success with it. Well, I was in Cleveland at the time, and there was a healthcare system. And the idea of brief strategic family therapy is that you actually bring the family into the therapeutic unit and kind of map the power dynamic within that family and try to slowly work with that family to kind of rearrange it so that there's a functioning executive in the family, whatever form that took. It doesn't have to be a traditional mother-father. It could be grandma, it could be a social worker, but to kind of reestablish some authority within a family um, over the children. Because usually in these cases, these were children who had become somewhat elevated in terms of their power within the family. And so there's this whole mapping process that they would do. And these were very skilled, seasoned therapists. And using this approach, they were having much better outcomes than just doing one-on-one therapy with the kids. So imagine taking mom, taking dad, taking all other things out, that sort of one-on-one therapy compared to this model where you're working with the entire family. Makes sense, but in terms of program fidelity, the therapists in Cleveland who were very used to just doing the one-on-one, they just couldn't get it. They couldn't get out of that mindset of working with the child. They would skip the steps necessary to do the family kind of power dynamic mapping. And ultimately, it failed. The intervention failed within this hospital system, even though it had been shown to be effective elsewhere. And so the difference there would be you have a different experience set among the clinicians. You had certainly a different motivation, right? So these clinicians who developed the program, they had a strong motivation to try this and have it work, whereas the physicians in Cleveland, or I'm sorry, the therapists in Cleveland were basically told they had to start doing this. And it kind of ran against what they were used to doing. And you can imagine that, that would could have been a barrier in itself to them implementing the program with fidelity. And so they ended up losing a lot of money over that because they, were going to implement that on a larger scale, but they couldn't even get to the point where they could implement the therapy appropriately. So that's just one example of where a research approach would be really important for figuring that out before you take it to any kind of scale. Okay, and again, I'm focusing here on evaluation only because your textbook is more focused on research, and that is more the focus of the course. But I want to make sure that you understand that whenever we talk about research, you could apply it to evaluation as well, and you actually should, including the ethical pieces that you learn in your CITI course. And often in evaluation, the first thing we do is conduct what's called a needs assessment. So that is where we basically look at our population and determine what their needs are. Let them tell you what they need, rather than us as practitioners or as researchers think they need, right? So if you're working with a population or it could be your staff, it could be your patient population, whatever. And when I say needs, I don't mean just like, hey, we need a new a new coffee pot in the break room. I'm talking about like what would decrease the level of anxiety on this floor? Let's say we're an acute psychiatric ward, and the um, the nurses are stressed, the social workers are stressed, the psychiatrists are stressed. There's a constantly escalated environment within that ward, that unit, and the culture's off. And so you might get different perspective on what's needed. And so you would do interviews with all those different people, not just the heads of the hospital, not just the nurses, not just the doctors. You try to involve everyone in that conversation to figure out what they think is contributing to that chaos. And or that, and that may be really impacting the quality of care and also impacting the health of the practitioners themselves, their well-being, their turnover rates, et cetera. So a needs assessment is expansive. It should be inclusive of everyone that might be involved in some sort of intervention. The next step would be to do a literature review, and you can see already the parallels with research. In this course, you're going to be asked to do a literature review. In the first week, you're more just kind of identifying some articles and yeah, doing a literature search. A literature review would be where you go through the existing literature, summarize articles, kind of develop a short list of papers that are important to your topic so that you make sure that you know the latest science or the latest evidence base on what it is that you're hoping to address. Whatever problem you identified through your needs assessment, you can focus then your literature review on that.
Dr. Cook, I have a question on that
Yes.
assignment with the literature review. Is that the template that we essentially fill out and turn it in? It's not that we're actually executing one, but we're going through those steps in the development. Is that what you're?
Okay, so I want to make sure that I answer that correctly. So in the first week, let's go ahead and look at make sure I'm sharing the screen here. Okay. Yeah, let me pause there because that's a really good question. So in week one, um, your first assignment is to do the CITI training, which again is super important. Great course. This is the course that all universities across the country use. It used to be that every institution, every research institute, et cetera, would have their own ethics training, like their own course. Very, very expensive to run. Usually had to have a staff person or two to do it. And so City was this collaborative where we're basically together. This is ridiculous. We're all trying to teach the same thing. And so they came up with the CITI. And National University subscribes to that. We pay to be part of that City collaborative. And the benefit to you is that you, by going through that course, you're going to get your certification as having passed the research ethics class. And it's actually very important. So when I've um, been asked to collaborate on research projects with other institutions, or early in my career when I was going to a new position, I was able to more quickly jump in and start working because I already had my city training. And it's considered an asset that way because they don't have to waste a week of pay while you go through the city course. Often there would be, depending on your role, there could be different modules. So for example, if you were doing animal research, there's a whole set of ethic research ethics courses that have to do with animal research, which I don't think any of you are planning on doing. No judgment if you are, but we don't expect students to be doing tons of that, so we don't include that module. But in any case, it is transferable across institutions. So, when you get that certificate, you can actually affiliate it with your next institution too. So let's say it says National University on it. You can actually transfer it to whatever institution that you're working at. It's not like you have to forever have it say National University. Okay, so I wanted to mention that. So thank you, Ray, for asking about assignments. And then assignment 2, week 1, is to plan a literature review. And let me go ahead and go through that. It's going to look a little different on my end than your end, but okay, so in this first week, I really want you to pick a topic that just interests you, okay? Like don't even necessarily think about what it's gonna, if you're gonna have to use this for the final paper or anything like that, just something that really interests you. Uh, and again, here it says your own interest, experience, your current role, your career goals. And I give a few examples. Note how you might plan to search the literature in preparation for a proposed study about your selected topic. Okay, and in chapter 2 of your textbook, which is a very good textbook. I don't always say that about textbooks, I promise. I like this textbook. It is pretty darn good. Um, and in chapter 2, there's some more guidance on how to prepare for a literature review. So yeah, you're gonna basically fill out this grid here. You're having a working title, and this in chapter 2 it goes over this. It's really important to kind of focus what you're looking at, right? And so you can change it, right? It's a working title, but it just kind of helps you get your head around what it is you're looking at. It doesn't even have to be in the form of a research question. It's just a working title. What is sort of the central question you wish to answer? So maybe I'm interested in, I had an uncle die from ALS, and it took him very quickly. He was diagnosed, let's see, I'll say October of one year, and he passed away by June of the next year from ALS. And I'm interested well, he was an arborist. He did all the trees at the University of Colorado campus. And I'm interested in whether his exposures to pesticides may have led to his ALS. Just a hypothesis. It actually is a hypothesis I have. um, and what is the research? Is there any evidence of a relationship between pesticide exposure and ALS? That's driven by personal experience. There's no right or wrong answers here about what your question is, but something that actually interests you. So what is your central question that you want to answer? So it's not good enough to say I'm interested in mental health. Well, that's great, and I'm glad you are. But what is it? What is it? Like what is it? And it could be something as basic as has anxiety actually increased among adolescents post-COVID than pre-COVID? Kind of a boring question, but it's important. Like, great, there's a lot of people, anxious people out there. Um, or what are or maybe it's an observation that there has been a rise in anxiety. What are the causes of that? Okay, so that's when you start to say, well, okay, broad topic, mental health, anxiety would also still be a broad topic, but like, how do we explain the recent increase in anxiety among youth? And then maybe we want to be more specific, right? And maybe we're interested in some specific, um, is it exposure to social media? Is it COVID? Is it whatever? Um, and you could look at that. So you want to answer some sort of central question. And then more importantly here, once you've got your working title and what your central question is, what keywords will you use to search the literature? So in the discussion this week, I have you kind of collaborate or think about how you would best go about doing a search. This one is specific to your project now, but you can use that discussion to kind of think about it. What would those keywords be? How would I get the literature that's relevant to my topic most effectively? And here, you don't have to go through, but it should be logical, right? So it should be expansive enough of a terms that you'll capture the relevant articles and specific enough that you won't get 20,000 articles that aren't relevant. So use a similar logic that you use for the discussion. This next question, what type of literature will you try to identify? What is included? What will be excluded? Um, and I guess this depends a little bit on the type of topic that you choose. What we're going for here, is it going to be only published scientific articles? Will it include what we call the gray literature? Especially for more evaluation work, it may not all appear in journals. It can appear in websites and things like that. So don't spend a lot of time with that question, but mostly, what types of sources will you use? Um, and then based on the type of approach, quantitative, qualitative, or mixed, what will be the role of the literature be in the study? So um, you kind of have to make a decision here. And this is just for the purposes of this exercise. Pick one. Safest would be mixed because then you can include both qualitative and quantitative. But if that's the case, what would be the role that the literature review would play? Would it be to develop a working hypothesis? Would it be to have a starting point for a central question in the case of quantitative research? And again, if you read chapter 2, it'll give you a little more guidance on what would be how a literature review would be used in those different types of study designs. And then you're simply to list the 10 articles that are aligned to your topic. So you don't have to provide an actual literature review. You don't have to do a summary of the articles. Simply, they should, though, come from your keyword search. So I should be able to find, well, I'm not going to do it, but in theory, I could go to your keyword search and those 10 articles would be among the ones you'd find. So that's what you're doing in week 1. To answer your question, Ray, planning a literature review. When we get to week 2, just to make sure that you're thinking a little bit ahead. And again, this does not that assignment does not assume any previous experience with research, so don't worry. I'm just I'm really interested in to know what you're interested in. And as we go through this course, then we can maybe refine that to a really good question that could be researched or evaluated in a way that would be hopefully interesting to you. So let's go to assignment 3, week 2. And so Ray, and everyone, in this assignment, uh, getting back to the literature review, you're actually going to review 5 to 8 studies that have addressed the problem. and it says include at least one quantitative, qualitative, and mixed method study. Here you will actually do a brief literature review as opposed to just listing the articles. Okay, and I don't need MOT, just paragraph um, and why it's it should be clear why it's relevant um, to the topic. And so the way that each of these assignments is laid out, and I haven't read the full instructions here so far, is this is your planning up here. And then, so after organizing your introduction section using the outline above, then write a 2 to 3 page introduction section to a research proposal using APA guidelines. Okay, so this is more just like bulleted. It doesn't have to, I mean, it should be coherent, but it could be, it doesn't have to be structured as a paragraph per se. It's after that you're going to want to write the relatively short 2 to 4 page paper. Let me open up the Word document so it's a little clearer. Okay, so you've got a little more room than what you saw in the HTML version there. So here you can, and expand this as needed, but you can just kind of briefly do it. And then you're going to, after you've organized your thoughts, then write the paper. Okay. And as the rubric will show you, see if there'd be a rubric that I can share here. I think I have to go to student view to see the rubric, which is annoying, sorry. And I'm on week 3 now, or week 2, I'm sorry, assignment 3. Okay, when I'm grading here, this is based on the actual paper. Okay, so use the outline to organize your thoughts. And I do want to see it, but like I'm not grading the outline, I'm grading the paper. So your study topic, a clear statement of the research problem, a review of the studies. This is really important, okay? And I'm already jumping ahead to week 2, but one of the reasons we do a literature review is to find the flaws, the deficiencies in the existing studies. And that's not just being super nitpicky and saying, well, this study's terrible, I don't like it. But you can do that too. Um, it's it's identifying gaps in our knowledge. Let's say that to this point, we've never actually had a randomized study to, a really high quality study to determine the effectiveness of this intervention. Okay, so this could be a global deficiency across different studies, not just one study. But you should also point to deficiencies in individual articles as you're doing the review of them. But this part is more like, what are we missing here? Is it the quality of evidence? Is it the fact that we only have evidence from, wealthy countries? We don't really have anything that if you're interested in what's happening in Uganda and all we have is research from Western countries, obviously that's a huge deficiency. So it's not just flaws or problems with the designs, but where's the knowledge gap? Why might we want to do some research to fill a gap? And then that sets you up to advance the significance of your proposed study for particular audiences. So again, so you're filling that gap in knowledge that now we can study what's happening in Uganda and not be reliant on Western evidence, or it's never been studied in women or children or whatever it is. It's not always just going to be populations that were excluded, but that's just an example. And then a purpose statement. Okay, so Ray, long-winded way of saying, yes, you are doing a literature review in week 2. Week 1, you are doing you're setting up your literature review. And this can actually be a different topic. You don't have to pick the same one for week two. Maybe you decide after week one, you're like, I've already had enough. You can switch gears in week two. All right. All right. You'll be happy to know that we actually streamlined this course as of 6 months ago, and you have less writing than you ever had. You used to have to write like 4 drafts of a whole paper, and by the end, you were so exhausted that I'm just telling you, you should be glad you took this course when you did. Okay. It's actually, the papers are reasonable, and I think they're going to set you up for more of what you would do in the real world in making a proposal. Okay, back to track two.
Because I have a question on
Sure, go ahead.
assignment one.
Let me go.
The,
Yeah, let me go back. This is good. Let me go back to. I'm sorry. Do you mean assignment two or assignment one?
no, you don't have to open it. My question is, does it take long to complete the certificate?
Oh, okay. Sorry, I should have just asked. It takes a minute. It takes a while.
It takes 5 hours. I spent one
Oh,
hour so far. It's 9 of those things. I've done 3.
Okay. Well, so it's about 10 hours total.
No, no. I say 5 to 6.
5 to 6. Okay. I
It's,
haven't
it's,
done it recently, so
I've done it's 3. It's 9 mods. It's 9 quizzes. I've done 3 of them, and
okay.
it took me an hour to do 3. It's,
Okay, good guess. Or good guess. Yeah, right. And so take it seriously because unlike some softball quizzes out there where you're like, oh, I'm gonna keep getting to try this, you want to pass those quizzes so to get your certification. So take your time. Um,
is it due on Sunday too? I haven't, let me see.
oh, well, let me see what I said and then I'll
do
tell you
week
what.
2.
Yeah.
At the conclusion of week 2.
Oh yeah, thank you.
Okay,
Yeah, you have
thank
until
you.
the end of week two. Okay. But to your point, because it does take
Hmm,
several hours to complete. Um, don't wait.
okay,
'Cause you don't want to rush it, and then you may not pass it. So if you just do what was suggested, do like a few modules at a time, then you'll be able to.
okay.
What I will say about this ethics training is, unlike some things you learn, it's super important. Like ethics is no joke, and um, some of my worst experiences on the job as a researcher have been because of ethical violations by colleagues. And that's not to say it's rampant, but it can have devastating consequences on the ability, the trust we have in researchers, the the scientific knowledge base. Um, and so, if you're seriously thinking of doing research, doing this course is fundamentally important. Let me share a horror story since I mentioned the very first study that I worked on, Alzheimer's case control study. I'm just a naive undergrad coming right out of college. I don't even know how research works. I'm like, I don't know. I read a bunch of papers and stuff. I didn't know how research worked. And I wanted a job. So I just, hey, here's a job. It was listed in the newspaper and said research assistant. And I was actually caregiving for someone with Alzheimer's disease at the time. I'm like, oh, Alzheimer's study? I'll sign up for it. And it turns out that study was funded by Philip Morris, the tobacco company, who had a very strong conflict of interest. It turns out that there were some studies out of France that were actually well-conducted studies that showed that smoking was protective against Alzheimer's, meaning if you smoked, you were less likely to get Alzheimer's. Counterintuitive as heck, but that was what the data was saying. Um, Turns out there was a huge competing risk problem there, which is that to get Alzheimer's disease, you have to live to a certain age, right? I mean, other than early onset, you gotta make it to 70, 80 years old on average, right? And so there are all kinds of biases that were leading to this consistent finding that people who smoked actually had lower rates of Alzheimer's disease. But it was this artifact of who was ending up in these studies. Okay, and well, and then so Philip Morris got wind of it, and you can only imagine they're like, after all the all the negative press that uh, big tobacco has had, um, wow, could it actually be protective? Obviously, I didn't take the job knowing that that was. Okay, and as soon as I knew that Philip Morris was among the funders, I left, and I ended up getting a job, thankfully at the same university, uh, um, working completely different area. So that was one. That was my like I thought I'm never working in research again. I didn't. And there's there's so many things, and that was more of just a conflict of interest issue. But there have been all kinds of stories where, um, a physician, for example, let's say there's a doctor who had case notes that he wanted to take home with him about his patients. It's not even doing research per se. He just has case notes, and it's about a sensitive topic like HIV/AIDS or some personal health information. Technically speaking, for every person whose data is breached, or like let's say he left the briefcase on the subway and it had this confidential information in it. If someone gets a hold of that, both he and his hospital could be held liable for that breach of confidentiality. Huge fines, right? And that could also, if it was done in the context of research, then beyond the fines, there could be, they could be banned from receiving federal funds for research, which who knows if that's even going to be a thing anymore. But anyway, yeah, they could be banned from receiving, a lot of research dollars. So there's huge consequences for data breaches and so on. So for those of you who are more on the health informatics side or healthcare admin who are more interested in hospital setting stuff, this is still super important. And so I think it's a good course. It's long, it's hard, but it's going to be an asset to you for sure. So, um, so yeah, that one's due in 2 weeks. This one's due Sunday. Don't spend a ton of time thinking about this one in terms of, I mean, pick a topic that interests you, but don't like stew over it. This isn't going to be your life's work. um, and that's true of all the assignments in here, but okay. And then assignment 3, let me go again through that. The quizzes are very much based on um, the video lessons, of which there are 5, which parallels the textbook. So the textbook and the video lessons, there's not perfect overlap, but they do go hand in hand. So you'll want to review those lessons, and there is a copy of the slides. But these are not meant to stand alone, so watch the videos. Okay. No slide is actually ever meant to stand alone. So, but they are there for purposes of review. There's also key terms, and I do recommend that you can use this kind of flashcard style. And you don't have to memorize this like it's a microbiology test, but you should be familiar with all of these concepts. And that's good practice for reviewing for the quiz as well. Okay, so yeah, and so every week there are video lessons, textbook readings. In this first one, there's actually quite a bit of reading, so make sure you do that as well. And this is the only week where there's 2 assignments, and this is due in week 2. And there's also a quiz each week and a discussion. Oh, no, wait, are there? Oh, there's two discussions. Wait, no, one discussion. Okay, one discussion. I got panicked there. No, one discussion per week. Okay. All right. We are at 6:40, so we're almost over an hour here. I'm just gonna quickly switch gears. I thank you for your questions. I appreciate that. I did want to talk a little bit. I'm gonna skip over a little bit of this. For now. I want to go to the section on the literature review. So because this is going to come up in week 2, and you're going to be starting to do a search for articles, your goal in doing a literature review or a literature search is you're looking to know what is already known about the problem or question. And when I say the problem or question, you know how you have your topic and then you have your question? You want to focus on that problem or question. So you don't want to have such a broad search that you're looking at mental health or even that you're looking at anxiety. You want to start to look at a question that you have identified as important or important to you. So there should be some that should be motivating your search. You don't want to know every article that was written on some very broad topic. You will be quickly overwhelmed with how much is out there. And then what has already been implemented and evaluated in terms of, if we're talking more in terms of evaluation, what has worked and what has not worked in the past. What are the current best practices? And then you might want to start to think, let's say you have some hypothesis, like I did, which is that pesticide exposure associated with the development of ALS? Well, is there a plausible biological basis for my, well, this isn't intervention so much, but my proposed association between these two variables? Well, you'd want to look into that, and so what is the biological plausibility of what I'm hypothesizing? Now, that's not going to apply to all topics, but you may want to think about possible mechanisms that could explain the association that you're proposing. So for example, if you're proposing a relationship between vaccines and autism, there should be a scientific, biologically plausible link between those two. And it's not actually that hard to come up with a plausible explanation. And unfortunately, sometimes that explanation is abused because you can say, well, any kind of inflammation can cause any number of disease. But you do want to think about what would be the as background. When you're looking at peer-reviewed journals, this is, in the scientific literature, you have to remember that the peer review process helps to assure that the published research meets basic standards related to methods, presentation, and reporting of results. There is plenty of stuff that gets published that it doesn't, just because it's published does not mean that it's the gospel. It does not mean that it's definitive. No one study is definitive, nor is it not flawed. There's always going to be flaws in research, but the way that scientific evidence is built is on these series of studies that build upon each other and try to improve on each other. So depending on our state of knowledge, we could say that we have, a strong evidence base, a weak evidence base, an emerging evidence base, et cetera, on a specific topic. And there are formal ways to kind of quantify the evidence base that you'll see in some systematic reviews. And this also comes up with effectiveness studies of drug trials, like what is the level of evidence that we have, but no single study is definitive. So keep that in mind. And peer reviewers make mistakes too, as far as letting things slip through but usually peer review means there's a biostatistician like me, a methodologist, maybe an epidemiologist or a clinical methodologist, a content expert. So let's say it's about heart disease, someone who's a clinician in that area. And they're, depending on the paper, there could be, more reviewers than that. But usually you're going to have someone who's looking at the study design, someone who's looking at the statistics that were performed, and then somebody who's reading it from a content perspective. And there has to be, pretty good consensus and multiple revisions. And sometimes they ask you to rerun your whole analysis, or they don't, and many times they reject papers. So it's a process that helps weed out the worst, but it does not guarantee that everything is the best. And just by nature of the fact that we're using statistical methods, we allow for a certain amount of uncertainty in our results, right? So we're going to say that this was statistically significant at some, p less than 0.05 or something like that. We made a decision. But what that means is that we could be wrong about 5% of the time. It doesn't mean that the paper is completely worthless or trash, and we'll never actually know that without retesting it. But there are what we call spurious findings that could be due to chance, could be due to unmeasured confounding, etc. So, no one paper, again, is definitive. All types of potential sources of bias that are important, and you can read about those in your textbook. Investigator bias, so just the bias of the investigator who's doing the research. They may have a worldview that biases their perception. There could be perverse financial biases, that's different, but just, their own sort of cultural background could be a bias. The bias from reviewers, publication bias. Publication bias has to do with the fact that there's a tendency to only publish positive findings and not negative findings, meaning, let's say that Semmelweis was, sharing his story of these experiments that failed. Would he publish the one about the midwives laying or delivering on the side versus the back? Probably not, because there was no difference. And even though now we know it's really important to document anything that we do, and negative findings can be just as informative as positive findings, especially to prevent somebody from doing the same thing. There's a tendency to only publish the one that kind of is positive, or where there was some sort of effect. And so that's a really important source of bias. And so the literature, or the scientific literature, works over the long haul. It corrects itself over time. And, that's why the literature review is so important, because you're trying to build on what's already there. You're not starting naively from, hey, maybe this is associated with this. I mean, you certainly can do that, but the scientific process, it builds on each other. And it's only when we've had multiple studies showing the same thing, using different methodologies, different populations, and hopefully increasingly not sophisticated, but quality study designs, then we can start to definitively show relationships. As an example, the relationship between smoking and cancer, specifically lung cancer, but all kinds of cancers, it took 20 some years after the study itself, which took about 20 years to conduct, to definitively show a association between smoking and lung cancer. We suspected it in 1940, 1950, but it did not become clear, widely accepted scientific knowledge until the early 70s. Then you had the decrease in smoking, and then it was not until a lot of studies came out on secondhand smoking and the effects of secondhand smoke on similar mortality and morbidity outcomes, then you started to have the laws implemented with respect to public smoking. So the lag between collecting the evidence, that evidence base being accepted by the scientific community, and then one further step for it to be accepted by the policymakers, that can be a very, very long time. So I would say the only counter example of that would be, and again, controversial because of the way it's needed, but vaccine trials are super fast, right? We can't wait 2 or 3 years to get enough data on vaccines because we need them for an emerging infection like COVID. And so, yes, some of the rigor that has been used for, for to get for a pharmaceutical to go through um, scientific review between the phase 1 trial and the phase 3 trial and a phase 4 and being accepted, it could be 8 years easily. Okay. And so, or more. And so there's a lot, it's controversial that we just kind of went straight to using it, but it can be justified because of the need, right? So the demand is there, they could show efficacy. And yeah, but normally under most circumstances, the process is more rigorous and takes more time. Another note about the literature. Not all journals are as good as other journals. Now, that's not to say that the top journals are all great and the lesser ones are not always, but you can kind of, and this takes some time to kind of absorb what is good and what is not. And some examples, New England Journal of Medicine, that and JAMA are considered top tier journals. Now, that does not mean that every paper in both those journals is great, but on average, they produce a lot of very important articles that have pretty big implications for the practice of medicine, usually, sometimes for public health, but most often for medicine. And their acceptance rate is very low, meaning a paper has to be very well done and also meet their standards. And so those ones are considered top tier, but there's lots of good journals out there. There are lower tier journals. There are a few out there that you see cited by newspapers and the New York Post, and I didn't call it a newspaper, where they sensationalize stories, and often these are coming out of less rigorously peer-reviewed journals. And I don't want to pick on the proceedings of the National Academy of Sciences, but it's kind of a garbagey journal. It's not as rigorous as some others. I don't want to pick on just that one. But we now have this era of kind of pay to play kind of thing where there are some kind of like vanity journals out there. Often those will not be in your indexed databases. So if you're using PubMed or Google Scholar, those articles are not going to appear. So one way to avoid a lot of the garbagey stuff is to use PubMed or Google Scholar. But again, you're going to ultimately, how you judge an article is about the quality of the research, your own estimation based on your understanding of research methods, the study population, the background of the researchers in terms of their expertise, etc. Okay. I just want to do, you probably won't encounter this, but occasionally a journal will publish its impact factor. And the impact factor has to do with how many other articles have used that paper in their own research. So they've cited that article. And so journals that have a higher impact factor tend to be cited by more scientists than those that aren't. So it's like it is a metric that kind of says how important a journal is to the scientific knowledge base, but it's a very rough indicator, but you will see that out there, and I don't want to bog you down too much in thinking about that. All right, well, I think that's enough to go on. I did want to show you real quickly though, since I mentioned Google Scholar. Okay, so Google Scholar is pretty good for doing searches, because what I like about Google Scholar is, let's say I'm looking at ALS and pesticides, my pet topic here. Oh, hey, there's a paper. Lucky me. Pesticide exposure and ALS. Boom, bang, boom. In neurotoxicology in 2012. What I like about Google Scholar is if I click on the little site, it will give me the APA format for this article very easily. And this is really important for your for all of your assignments in at least within the public health program. It may, I'm guessing, in a lot of your other courses as well. If you want the APA format, you can get it really easily from this database. That's one thing I like about Google Scholar. Google Scholar, you will get some things that are more in what we call the gray literature. So PDFs, websites, things like that. So you kind of have to look to see whether it's a peer-reviewed journal or not. But well, there's quite a bit of interest in this topic. Who knew? I'm going to have to start reading about this. So Google Scholar. The other really good one, and I would actually prefer this one, but it's just my own preference, is PubMed. And to find PubMed, just type PubMed in Google. That's how I get to it every time. PubMed is nice, and this comes up in their discussion as well, is that it allows for not only logical operators, so I could say like ALS or what's helping me out here? Okay, so like maybe sometimes it appears as ALS, sometimes it appears as amyotrophic. I can't even pronounce it. That's why they call it ALS. Amyotrophic lateral sclerosis, and and I want to say oops, sorry, and pesticide. And then maybe I'll say or herbicide. That's probably, I mean, I don't know, maybe they're called other things, right? But okay, so you can use these logical operators, which comes up in your assignment, both in your assignment and in the discussion. You want to be careful in how you place these, though, these operators, and you sometimes have to play with it to make sure that you're doing it right. But ideally, you can see the count of results that you get. And if I get rid of the and I say or, it should give me more in theory. Yeah, okay. Just by switching it from and to or, I went from 192 articles to 33,562. And the reason, now it doesn't even have to be about ALS anymore. It could just be anything about pesticides or herbicides. So I went from an and statement of I want to know ALS and pesticides to ALS or pesticides. Obviously, I'm getting way more hits with the or statement. So do be careful. And then you need to use parentheses in here. The other thing I'll show you that I like about PubMed over Google Scholar is if you click on the NIH banner here, you can do a mesh term search. A mesh term is this is why I hate acronyms. What the heck does mesh mean? It's a shorthand for medical terms. And it's, or I should say, it's a standardized way of referring to medical concepts or constructs. And so if I'm at all unclear about how to phrase something, let's say there's a, in common language, there's different terms for things. So, um, you know, let's say I didn't know that ALS was the same thing as Lou Gehrig's disease. And all I knew of it was Lou Gehrig's disease. Like Lou Gehrig's disease. So I'm gonna do Lou Gehrig. I'm not even sure if I know how to spell it. Okay, Lou Gehrig's disease. Oops, it didn't. Yeah, no, that doesn't look right. I thought that was gonna work. Was that because of my terms or my spelling? Okay.
Might be the spelling.
Might have been the spelling. Who knows how to spell Lou Gehrig?
Lou, and then it's Gehrig.
I thought that's a G. Thank you. Okay.
Yep, ALS.
Okay. So you can see here that there's all these different possible variations on this term, including motor neuron disease, and obviously a lot of these include ALS as part of the title. I didn't know that there was something called Guam disease. Okay, so rather than me have to figure that out, I can use the kind of larger mesh terms, and it'll come up if I use this as the term, then I don't have to worry about was I broad enough, okay? Because if I had just gone into PubMed and typed Lou Gehrig, it's only looking for Lou Gehrig by default. But if I did the mesh term, which is okay, so this is the mesh term here. Oh, and it's the major topic. I didn't want to do that. I was getting too fancy there. Okay. So now if I take this back over to PubMed, okay, now if I have to do the full thing in quotes, followed by the term mesh in brackets. Now when I search, it's going to look for all of those all those different variants, right? I don't have to worry about the order. I don't have to worry about, now I don't have to worry about spelling. It should give me, and just a word of caution, this would be, and it would appear anywhere in the abstract or anywhere in the title. And there's ways you can modify searches, only searching titles, only searching abstracts. As far as I know, it's not doing full text search. That probably will change soon, especially with AI capabilities. So you can correct me on that one. But right now it's really just looking at, and so this is, I have 3,786 results just for ALS, which actually isn't that many articles, to be perfectly honest. And very few older ones, a lot in the more recent years. Okay. Compared to other diseases, that's pretty small number. Although it's a pretty rare disease. It's I think it's 1 in 25,000 people maybe develop ALS. It's pretty, which doesn't sound very rare, but that's pretty rare. Okay. And one reason, here's the interesting research point is that one reason there aren't many studies on ALS is because there aren't many survivors of ALS. There's more research on diseases you survive than there are ones that you don't survive, which is completely backwards for what it should be. And I can, my mother died from pancreatic cancer, and I can tell you right now, pancreatic cancer does not get as much funding as other types of cancer that people survive a lot. So, and that's not to take anything away from the importance of doing research on those other areas, but because we don't have very many pancreatic cancer survivors, we don't have as many rich pancreatic cancer survivors, we don't have as many donors donating to research. I would say the same is true for a lot of things, even suicide research. There are some people who will donate, loved ones of people who passed away, etc., but there's no survivors of that, right? Well, there are people who self-harm and survive, but there aren't a lot of donors out there, and so it tends to be underfunded. So obviously we could have a more rational system for funding of research. That's a whole nother topic. But if you're curious to see the disparities across, there's a research topic for you right there. The disparities across different cancers, you could just type those in and see how much research has been done. Now, that's not purely a function of funding, but it's a good proxy for it. Usually research is done with some funding, although not always. All right, well, I don't want to take up too much of your time, and we are up to 7 o'clock. If there aren't any other questions, I did show you some strategies here in PubMed. I recommend that when you do the discussion, think about the logic of how you would do that search, and then reflect on it a little bit, look at other people's answers, and kind of gauge, all right, do I understand the logic of what would result in the best set of hits? It's an art, it really is, and it takes practice to do an effective literature search. So, I would say there's no wrong answers, and that's true, but your ultimate search should be pretty logical. And if you were to write what we call a systematic review as a type of research paper, your methodology is your search for the most part. So your methodology becomes your search statement. At least a big part of it is like, how did you choose to include or exclude different articles into your review? Now, obviously, you have to go read all the articles and rate their quality, and but that's the challenge of doing a systematic, that's the systematic part of a systematic review. So some of you may want to do that, and that is a legitimate form of research. Tends to get its nose turned up on it because people will say you're not really doing research, you're just looking at other people's research. It's true, but if we didn't do that, then it would be this vast cloud of papers, and it would be very hard to make sense of where we kind of are with science. And I think a good example of that would be the Cochrane reviews. I don't know if I can. Okay, so the Cochrane reviews originally were only for drugs, right? So drug interventions. And what they were doing was pooling all the evidence across all the different trials to determine whether drugs are actually efficacious. And it's important, right? So we don't end up having one trial with a positive result resulting in, a massive switch of practice to some new treatment. That doesn't happen, but it's kind of a safeguard against that. And so they're constantly doing these updates of systematic reviews. And actually, Cochrane's now has like a public health arm as well, where they're doing, systematic reviews of, public health interventions and stuff. So it's pretty important stuff. Especially given the proliferation of articles, it used to be, you can look at any of these topics. Let me do something else. I'm not gonna do monkeypox because that just came out. um, I'll do. Okay, I'll do MS, multiple sclerosis. I'm kind of on a kick here. Okay, and if I do that search, you can see the proliferation. Oh, I have some filters on there from last time I was in. What? I spelled it wrong. You can see that over time, the proliferation of research articles, it's ever increasing numbers each year. So in 2024, there were 6,792 articles. I guess well, thanks to COVID, there were probably some weird gaps here, but overall trend, you can see, massive numbers of publications. And so we do need these systematic reviews every once in a while to say, okay, well, what's the state of the science here? But you can also filter your results, 5 years, etc. And also you can cheat a little bit here and just say, I want free full text. That way you don't have to worry about digging it out of the library or whatever. All right. Well, everyone, thank you for taking time out of your busy schedules to meet with me. I'm looking forward to seeing your thoughts and ideas, especially given your interesting biographies. I'm really interested to see what you come up with. And if you need any assistance refining a topic, or you have an area that you are interested in but don't quite know how to narrow it down, I'd be happy to, just send me an email. I can give you some suggestions, but ultimately I want it to be your baby and your interest. So I mostly want you to pick something you're passionate about, because that's what's going to be the most motivating for you as a practitioner. All right. Well, thank you very much, everyone. Have a great night. I'll see you soon.